No one ever told you that one of the most common and frankly uncomfortable medical conditions could often be managed and even reversed without a single visit to the surgeon's office. Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Now, today we are discussing a delicate topic, I know, but understanding how to manage it is absolutely crucial for your quality of life. Be sure to stay with me until the very end, because I will reveal 3 simple at-home habits you can start today. One of them is a detail most people get completely wrong, and it could be the key to finally finding relief. Let's talk about a condition that affects millions, yet is spoken about in whispers: hemorrhoids. Put simply, these are swollen, inflamed knots of tissue in the lower rectum, consisting of veins, arteries, connective tissue, and muscle cells. To understand how to treat them, we must first understand that there are 2 primary types, internal and external. They are separated by an anatomical landmark called the dentate line. Now, why does this matter? Because everything above this line has its origins in the early gut tissue of an embryo, while everything below it originates from what becomes our skin. This fundamental difference in origin is why they feel so different. Internal hemorrhoids, developing above the line, rarely cause pain because they are served by nerves that sense pressure, not sharp pain. This is why their most common symptom is bleeding. External hemorrhoids, on the other hand, developing below the line, are covered with a very skin-like tissue and are rich in pain receptors. This is why they can be excruciatingly painful. Now, believe it or not, these vascular cushions are a normal part of our anatomy. In their healthy state, they form a ring that contributes about 15 to 20% of the resting pressure in the anal canal, helping to maintain continence and control the passage of gas. They are not a disease in themselves. The problem arises under unfavorable circumstances: a genetic predisposition, a sedentary lifestyle, chronic constipation, or anything that repeatedly increases pressure in those veins and impairs blood flow out of them. This pressure causes the veins to stretch and dilate, the supporting connective tissue and muscle weaken, and the hemorrhoidal cushions begin to enlarge and protrude. This is when they become a disease. Internal hemorrhoids are classified into 4 stages. Stage 1, they are simply enlarged. Stage 2, they may protrude during a bowel movement but retract on their own. By stage 3, they protrude and must be manually pushed back in. And in stage 4, they are permanently prolapsed. The dangers they pose are not in the nodes themselves, but in their complications. Internal hemorrhoids can bleed when damaged by passing stool. This bleeding can even be arterial, which carries a risk of significant blood loss over time. Prolapsed nodes can also leak mucus, causing irritation, itching, and hygiene challenges. The most common complication of external hemorrhoids is far more dramatic: thrombosis. This is when a blood clot forms within the hemorrhoid, causing sudden, severe pain and swelling. In the worst cases, this can lead to necrosis, where the tissue dies and the body begins to reject it, triggering a powerful inflammatory response. So, how do we treat them? First, a vital principle: if they are not causing symptoms, you do not need to treat them. It is difficult to relieve a patient who has no complaints. We only begin treatment when the hemorrhoids become symptomatic, causing bleeding, intense itching, pain, or interfering with daily life. For the vast majority of cases, conservative at-home therapy is highly effective. And this brings us to the 3 pillars of self-care I promised you. First, you must address bowel habits by increasing the bulk of your stool. The smaller and harder the stool, the more pressure you must generate to pass it. The solution is simple: drink more fluids and dramatically increase your fiber intake. One of the best tools for this is psyllium husk. It is a soluble, non-fermentable fiber that swells with water in your gut, creating a soft, bulky, easy-to-pass stool. This directly reduces the straining that causes hemorrhoids in the first place. A word of caution: start with a small amount, perhaps half a teaspoon a day, and gradually increase to avoid paradoxical constipation. Second is a technique that is so often misunderstood. I recommend warm baths, as warm as you can comfortably tolerate, for about 10 minutes twice a day. ideally after each bowel movement. And here's the critical detail I mentioned. A full bath in a tub is far superior to a small sitz bath in a basin. Sitting in a small basin can actually increase venous congestion and pressure. A full warm bath, however, allows the internal sphincter muscle to fully relax. This relaxation reduces pressure within the hemorrhoidal veins, allowing blood to flow away from the area and reducing swelling. And the third habit is to change how you use the restroom. The toilet is not a library, nor is it a place to scroll through your phone. The longer you sit, the more pressure you put on the veins in your rectum. Use the toilet only for its intended purpose, and when you are finished, get up. These simple measures, more fiber, proper warm baths, and shorter toilet time, can not only relieve symptoms, but can even help reverse the condition, moving it from a more severe stage to a milder one. Of course, there are also topical creams and suppositories that can help manage symptoms like pain and inflammation, as well as oral medications known as venotonics that can improve the tone of the veins. If these methods fail, or if you experience severe complications like thrombosis or persistent bleeding, medical procedures are available. These range from minimally invasive outpatient options like rubber band ligation and laser coagulation, to, in the most severe cases, surgical removal. But the goal is to never let it get that far. Pay attention to your body. Avoid activities that create intense intra-abdominal pressure, like very heavy lifting. Manage your weight and ensure your diet is rich in fiber and water to promote regular, effortless bowel movements. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.